Every cancer is a genetic disease. The numbers of medical oncologists were so low.
Yeah.
The country is in double standard.
Yeah.
The important people in the family has to drive it. First of all, family says, I need the best treatment. One cycle is costing 5 lakh rupees. When it just touches the doorstep, it is a sense of impending doom.
Hi, my name is Samara Mahindra and I'm the founder of Carum. Today is a very special day because I think I've been trying to get this conversation going for many years and I have finally got Dr. Ankur Bahl on this chair here. The medical fraternity, the country, the world knows who Dr. Ankur Bahl is. However, I would love, Doc, if you can give a little bit of an introduction for yourself and most importantly, why you chose oncology.
Yeah, thanks, Mahindra. I'm Ankur Bahl. I'm a medical oncologist and hemato-oncologist, a doctor who treats cancer with the chemotherapy, immunotherapy, targeted therapy, the combination, and treating both solid cancers as well as blood cancers. So it's been a very long journey of last 25 years, entering a medical school and slowly developing and liking a branch. But it actually happened in 2004-5 when I won't disclose that one of my family members had developed a cancer. Then I have to see that world, that what exactly is the world when we were training in internal medicine, cardiology, gastroenterology, nephrology. They were the branches. So when I entered Rajiv Gandhi Cancer Institute to get myself very close treated, so then I realized that there's a huge unmet need.
Yes.
And in those days, I'm talking about like 20 years back, in those days, the numbers of medical oncologists were so low.
Yeah.
At this point also in 2025, they're also pretty low. But at that time, being an oncologist was a hot cake. And I'm talking about my career. I thought that time that if I choose this part of the career, first of all, I'll be doing justice to those patients who are not getting this treatment well. And I felt for myself also, if I go into oncology, problems which I'll be facing in next 10 years or 1.5 decades will be quite lesser than cardiology, gastroenterology, or nephrology. Those branches were saturated.
True. And Dr. Ankur, this is what I tell most people, that when cancer comes home and touches your doorstep, that's when your world changes, and thank you so much for giving back and coming into this field of oncology. You have treated very close family members of mine, so we are forever grateful. This is a question that you probably get asked every single day. Why me?
Yeah.
So, Dr. Ankur, why me? Why him? Why her? Why are we getting
So
cancer?
why me is a question, it's a frequently asked question, FAQ in my OPD, that Dr. Saab, mujhe kyun ho gaya hai? So there are certain reasons we get cancer from the age of 1 to age 90 also. So when a patient of 30, 40 years comes to me, who have just joined his job, who is in a corporate, who's a teacher, who's a young husband, or just a new father or a new mother, then cancer touching their doorstep, the first question is, mere se kya galat hua hai, and why God has chosen me.
Yes.
So first of all, we take a good history that is there any abuse, a tobacco abuse, a alcohol abuse, are you obese? Generally, we take this history in few seconds, but most of them are not having any abuse. Abuse means significant abuse of 2-3 decades. It's not like taking a few cigarettes and then you get cancer. You got taking a booze for last 6 months and then you develop cancer. The most important thing and the most answer which I give to my patient is that it is a disease of genomics. It's not directly related to your abuse or your being obese. It's related to genomics. If we deep down and take a good family history, a good pedigree history, then we find that one Masi and one paternal uncle or mother diagnosed, but not mother was not detected, but that the diagnosis of cancer was not made 30 years back. So these are multifactorial, and many of the time we say that it is idiopathic also. You are just the first case in your family. So why me? anybody can have cancer. This is the biggest myth also in our mind that I cannot develop cancer. I'm so fit. I take a balanced diet. I don't consume alcohol or tobacco. मुझे नहीं हो सकता. That's the biggest myth. But when it comes to the patient and their family, when it just touches the doorstep, it is a sense of impending doom. And हिंदी में बोलता हूँ तोते हो जाते हैं. So then the story starts, where to go, how to go, what to expect. But at that evening or that night, it's a mayhem.
Light shut. So, Dr. Ankur, you're saying, the breaking the news and what a family and a patient experiences when they've been told that they've been diagnosed with cancer is life-shattering, especially at the time of being told this. What can one do? How important do you think emotional, mental support is at this time for a family and a patient?
Yeah. And this is a tricky question because just imagine at 6 o'clock or 7 o'clock, there's a message comes on your mobile that your aunt or your spouse or your child has been diagnosed with cancer and the report of the biopsy comes. That night is very critical. That night, a person will, first of all, there's a weapon in your hand, Google, he will Google it.
Exactly.
What is this and where I can meet an oncologist. But most commonly what it happens is he asks a chacha ji or a mama ji or a senior person in the home. Then the community, the Indian community is like this, that somebody is willing to help. So then that senior person, whosoever it is, a chacha ji, mama ji, a parent or a neighbor or a panchayat head, they will direct that couple or that patient, that the past will be remembered, that we have a previous patient who was being treated by X hospital, X doctor. I have in a close contact with that doctor. Let me fix an appointment. It's not that the intentions of that senior person is absolutely right, but his choice might not be right. So this is a very crucial junction. That night is very important. The whole force of the family, the extended family, goes down to that patient so that this patient can be helped next morning. Patient is aware, patient at that night is aware that I've got cancer, but he's not aware about the perfect diagnosis, which kind of cancer, which stage of cancer, what is going to be with him. But that night is enough to shatter him, to shatter his mind, soul. What comes, he might not be seeking treatment, but he definitely seeks his death. Whatever the stage is, the community has given such a taboo to cancer that night the patient and the party is shattered. So this is very important that our caretakers back home, the senior most people back home, the neighbors, the panchayat, the sarpanch, the head of that colony or that apartment should be bold enough to make them understand, do not worry, we have a solution, and this institution or this doctor has given such solutions many times in his career. Let's go to him. Let's go to him. But India, seriously, is lacking that. We have everything. We have softwares for everything. We have reels for everything. But I haven't seen a reel or a official reel or official video from any of the hospital from the Southeast Asia that how to tackle that patient and that the immediate next of kin that night, which is most crucial. Because they will start searching, and I can see from their history that if I apply Control H onto the Google, I can see from their history that they have gone haywire, and if not guided properly, and if it is just a couple in on 25th floor in a Gurgaon, that this couple might be trapped by a person who is actually not an oncologist. So this is a catch-22 situation where the senior most people, friends, community should come forward to give the right guidance.
Guidance, yeah. Absolutely. I think that's what you said is where really the root of the problem is. We say this all the time. It's the lack of awareness. It's the misguided information that we see every single day. Yeah, and it's just the misconceptions that people then get from that. And there is a fear associated to their diagnosis, and then they think it's the end of the world. And that's a classic case that happens every single day.
Yeah.
Why are more and more younger people getting diagnosed with cancer?
More and more younger people are diagnosed with cancer in India. There's no very simple answer to it. But yes, the exposure to the carcinogens, which are tobacco, either in the form of smoked or smokeless tobacco. Suppose my child who is just 18, he will enter some groups as a peer pressure.
Absolutely.
When he enters, he won't be allowed entry to that group if he doesn't smoke. So he will enter and start smoking. And when he has achieved that level of confidence with that smoke cigarette, then he will increase that level to some other substance.
Yes.
Then other substance.
It's a gateway.
Yeah, gateway. And then maybe to alcohol. And then he is 18, and as the time passes on, he'll get married. Before his sons or daughters are born, then the consumption will increase. Then he will go for a job, and they very commonly and very casually say that we have stress. We have a stress of job. You go to between lunch area, and between the all corporate people are coming down to have a break, to have that sutta break.
Yeah.
What is the need? Okay, so then they will go into the journey. They will be get promoted. They will be getting busier, and then they will turn 40, and later they will turn 45, 48. And when they come to my age, then that son will be of 18, 19 years of age. The person who have started at 18 is now 48. His son is now 18.
Yes.
His son is now entering into that group, which he entered 30 years back. But some other damage has been done to me. For 30 years, I'm smoking. Now I want to quit because my son wants to smoke. Son will always smoke if the father is smoking.
Absolutely.
Son will always be inclined toward that hard drinks glass if the father is there.
Absolutely.
If you have a cupboard with amazing bottles in your drawing room, your children always see that. The children always see those social media and all those things. So one is smoking, early exposure to this carcinogen. Second important point is obesity. Our children are actually not going outstairs. They're just sitting on those video games and PlayStations.
Sedentary.
They haven't seen the sun and the moon. So sedentary lifestyle. I remember my old days, we do not used to have so much in my home. We used to go out and play cricket, play hockey, play football. There's nothing outside. Cricket is being just played on TV with all those video games. So sedentary lifestyle, carcinogens, huge exposure of this unprocessed junk foods to these kids. How much you will stop if your school is serving? Your school serving has these junk foods in the menu.
Yes.
You can't stop your children from eating. They have to eat something. And fourth thing is if they are bringing those genes from the family. So there are two types of cancer which we have to understand. And through this podcast, if the community can understand, every cancer is a genetic disease, but every cancer is not familial. So there's a difference between genetic disease and familial disease. Familial disease are those diseases in which family is being run at least in 1 or 2 generations and then coming to kids. Every cancer is a genetic disease because mutation happens in every cancer. But if dadi, mother and the daughter are suffering from breast cancer, ovarian cancer, colon cancer in any combination, that would be called as familial. So these are the factors that why young population are in epidemiology, we see lots of young patients. We see lots of young girls without even smoking history are getting lung cancer. We're getting kids with lung cancer. We are saying young cancer because the cancer centers are increasing. It's being diagnosed more in last 1 or 2 decades. Earlier, we used to say tuberculosis, they don't respond, give second line tuberculosis. Now, the family practitioner sees cancer as one of the differential diagnoses of any chronic illness. So the pyramid is getting educated, enriched from below. Our health system was from down upward. Now from below upward, all these general practitioners who are sitting in community, they take cancer as one of the differential diagnoses of any chronic symptoms, and so are the patient sides. Patients are also accepting and telling the physician कि डॉक्टर साहब ठीक नहीं हो रहा हूँ, कहीं कैंसर तो नहीं है. All those things. Insurance companies are giving, acknowledging this disease. So it's lots happening in the cloud. A lot of patients are listening when I go to metro. I can see lots of patients discussing metro. Earlier, tobacco or cancer was a taboo. If somebody has been diagnosed cancer, just stay away from that patient. So now the community has accepted, and the community is willing to go for even preventive screening test. Many times in Gurgaon, I see 1 or 2 patients daily who have got to me for screening and diagnose breast cancer in stage 1 through screening. So we are leveling up, not to a level. We might do it in next 2-3 decades, but yes, community, both from the doctor side and the general practitioner side, they are educated, they are acknowledging this disease. That is why the incidence is increasing, and younger population are not spared. That's it.
So one of the questions we keep getting is, why did my child get cancer, right? So this you would put on a genetic predisposition that has been there for maybe many generations.
Yes.
Okay. So that answers a very big question, because that is a question that is always being asked. I have to ask you this because it's the topic of the season, if I should say right now, about the vaccines and the cancer vaccines. The one that has just been kind of spoken about from Russia, and we would love your take as a medical professional to tell us what exactly this is.
So we have been hearing out and reading out through Russian media that Pronix is a mRNA vaccine and they have got early breakthroughs, and so this vaccine is a part of immunology treatment. And we in India are using lots of vaccine to treat cancer, but the news which is coming from that part of the world, from Russia, on mRNA, they have done some early trials. They have done some early trials on animal models and some human models, and they have got the breakthrough. So this treatment has still not entered any phase 2 or phase 3 randomized trials, and no guidelines, neither from the Russian side, nor from the Chinese side, nor from the European side, we call as ESMO guidelines, or not from ASCO side, American Society of Clinical Oncology, and not at all from NCCN guidelines. NCCN guidelines are the guidelines which whole world follows there are treatment protocols. So this is just a early news. We are not denying it can be a very effective treatment in next coming years, but at this point of time in August 2025, this is just a way. It's a breakthrough way. There are no trials to it, and this point of time we can't prescribe, but we are looking forward very critically to this development of this vaccine and incorporating this vaccine into a good phase 3 randomized trial so that our patients get benefited. But this is too premature to discuss and giving treatment by giving patients option of mRNA vaccines.
So is this similar to, say, the Gardasil, like the cervical cancer vaccine?
No, it is absolutely different. So Gardasil and cervical cancer vaccines are based on that oncolytic virus. So we have strains of human papilloma virus. So Gardasil vaccine and other cervical cancers are based on this. Some are tetravalent vaccine, some are bivalent vaccine on the basis of the strains of HPV.
Right.
They are inoculating HPV dose at a very minimal level, so that inoculation becomes a vaccine when it goes into a human body. So, but those mRNA vaccines are genetically engineered vaccines, so they have to be tried. Cervical cancer vaccine is a preventive vaccine. mRNA vaccine, which Russia has developed, electronics, is a therapeutic vaccine.
Right. Okay.
But with no clinical trials, no data to it. Let the data mature. Let them publish in a good peer journal. Show us in our annual proceedings internationally, world over. We doctors are thrilled, and if something comes like, it will be best for our patients.
Absolutely, absolutely. One more serious question, which is very important, is the financial catastrophic, effect that cancer treatment has on patients. We see this all the time, and I want you to talk a little bit about financial education, health insurance playing a very big role over here, and how can we change this and what can we do?
Yes, Samara, wonderful question. And I would say that the financial toxicity kills more than the cancer toxicity.
Exactly.
At times we are dejected. Even the doctor is dejected, the family person, next of kin, the caretaker dejected.
Yeah.
Why? Because you are being diagnosed with stage 4 cancer. You choose the best hospital, with the best of the facilities are there. You've taken the doctor's appointment, you've done all those PET scan biopsies. When it comes to the treatment part, then doctor tells you that this part of this cycle of chemo or immuno will be costing you around 4.5 lakh rupees per cycle. First of all, family says, I need the best treatment. And the guideline says that incorporate immuno plus chemo. One cycle is costing 5 lakh rupees. And who is sitting across the table? A young couple who has just managed to have 50-60 lakh rupees savings from the 5-6 years of working in corporate. And okay, then they say, we'll proceed. Marta kya na karta.
Yeah.
They have to start. So thankfully, there are some patient assistance program from the pharmaceutical side. They give some vials free and all. So Marta kya na karta, let's start. So they have been giving premium of their insurance for many years. But what they have signed 10 years back, we don't know. You signed daily in your day-to-day activity, you download 5-6 apps and you accept without even reading the clause because you're in a hurry to go to Facebook or LinkedIn or Insta pages. So they have been giving premium for last many years. Now it comes to them and they have started treatment. Treatment has to be started. So we give treatment, we give approvals, we give papers to the insurance, and suddenly, as a shock of the life, at 4 o'clock, the email company says, the insurance company says, it is not approved. Why? Because when you signed the clause in 1998 or in year 2004, when the first contract was being signed, immunotherapy was ruled out. Immunotherapy is ruled out. What to do? This has happened with my father-in-law. He's a 76-year-old man taking immunotherapy every 21 days. He has no insurance. A doctor's father-in-law doesn't have insurance. So in India, 8 to 9% of people are actually insured. Just 8 to 9% of the people, and miniature insurance. And the insurance has many clauses, many clauses. This will be used, this will be not be used. So daily we spend at least 1 to 2 hours fighting with these insurance companies that why are you not approving? This is in the guidelines, but say that, sir, you are a hospital, but the bond was done between the company and the normal human person 7 years back. This was not against. So this is the time. This is a time when community has accepted this disease, and when I will say young insurers who have to give the minimum premium.
Yeah.
Suppose a 20-30 साल का लड़का अगर कोई इंश्योरेंस करा रहा है तो please read critically. Just take one day more extra time. Read it properly, show it to your general practitioner.
Yeah.
Why not? When we can show our property papers to our experts, why can't we take a help of a general practitioner कि डॉक्टर साहब देख लो सब कुछ covered है कि नहीं है, or that senior person in the community. But we are in a hurry. This is a, I won't mind saying this to you, Samara, on your show. The country is in double standard.
Yeah.
Very serious double standard. Any car cannot come on the road without insurance.
Yeah.
But a human body can be delivered without insurance.
Exactly.
A policeman asks what? He never asks driver's insurance, health insurance. He will always say, गाड़ी का इंश्योरेंस दिखा दो, गाड़ी का पोल्यूशन दिखा दो. अब जो चला रहा है उसका तो देख लो, उसका इंश्योरेंस है कि नहीं है. So this is a country's bleeding actually into it. And we always say, we take an opportunity when a cancer patient comes to me. I have to see that patient not just because it's a cancer. Cancer is a disease of family. It's a disease of community. Whenever young people come to me, I just ask them, तेरा insurance तो है ना? तेरी मम्मी का नहीं है. Because they have to sell. They have to sell land. They have to sell flats.
Everything they have.
Yes, they have to sell their gold. इलाज तो कराना ही है. But I ask that boy who is just 22 in a college, you have your insurance. Have you realized that?
Yeah.
So this is very painful.
Yeah.
Double pain comes. A cancer and no money is like having a double pain. Then the family shatters that night. Nobody gives you that comfort. People can give you comfort emotionally, psychologically, psychosexually. But who gives that financial counseling? कि नहीं कुछ नहीं होता मैं तेरे को 20 लाख रुपए देता हूँ. Who does it? So this is a double sense of impending doom.
But do you feel that insurance also has to come out and build better products for covering
Yes.
cancer?
So they're doing it. I feel they're doing it. They come up. I can see on various advertisement that 299 रुपए में जीवन को secure कराएं 300. They are doing it. But that age, the myth के मुझे तो हो नहीं सकता कुछ. मैं तो ठीक हूँ. मैं इसमें 299 रुपए महीने में भी क्यों लगाऊं? Why not I take a cigarette packet? So and again the important people in the family has to drive it.
Yeah.
If they have not done insurance, they might not percolate down to your family.
Yeah.
If somebody has done insurance and they have taken the claim of that insurance, then he will say insurance करा लो पहले फिर सब कुछ कर. So this is important. Insurance part is very important, and by getting insurance also we are getting fooled. Critical illness and all those things, immunotherapy, oncology is not covered. So it was a myth we were able to break, that patients used to understand, if I have insurance, I have to be admitted for at least 24 hours. अगर मेरे पास insurance है तो मुझे 24 घंटे रहना पड़ेगा अस्पताल में. This is not there. Daycare can be utilized very well. OPD can be utilized very well. So smart patients.
Yeah.
We are entering a smart world.
Yeah.
Your phone is smart, your thinking is smart, but your insurance is third class.
Yeah.
So just go back and see your insurance, manipulate it, get it done immediately, because I have seen, Samara, I've observed it. जिसके पास नहीं होता बीमारी उसी को होती है. The person who doesn't have insurance, the disease happens to him only.
Yeah. No, I think that's so important. I'm going to do that actually, because I just thought that, I haven't read the
clauses.
So, Dr. Ankur, we've asked you all the serious questions now, but now we're going to get to the ones that I'm most excited for. What we don't find out about is the person behind the stethoscope, the mask. So I'm going to go in there and get a little more information. Tell me about, and I'm sure there are many, but tell me about a story, a family, an incident in all your years working in this field that changed the way you looked at life.
Yeah. So I remember a patient, I'll not name the patient, but they were a young couple. The patient age was 32. He must be 38. And the wife was must be of same age. So they came to me in October 21 and with a pancreatic cancer, stage 4. Stage 4 pancreatic cancer in 2021 October. And it's just said, and a well-read couple. The boy does a business in sari, a big-time sari business, and the spouse was a management person. So I said that all the questions were being answered. What is the diagnosis? What is the stage? And what is the longevity? Longevity is the most common, frequently asked questions. जैसे गाड़ी में पूछते हैं ना कि average क्या देती है?
Yeah.
Cancer patient they ask longevity. What is the survival? How much I will live? But there was so much. There was a pressure also. I mean, so I said that in general scenario in pancreatic cancer, which is stage 4 gone to liver, the survival is usually ballpark 1.5 years. When you tell all those things, the environment gets emotional.
Yeah.
Doctor has to take a pause. Everybody will cry. There was a like Dadi and everybody was there. So there was one sentence from that wife. मैं नहीं जाने दूंगी. I will not let him go. मैं भी देखती हूँ. I will see. So it was at that time as a doctor, I felt that it's a immediate reaction.
Mm.
It might be her ego. It might be a overconfidence that I'm telling I'm an oncologist and I am giving a average of 1.5, average, median, whatever you say. But this lady is saying, मैं नहीं जाने दूंगी. So, okay, so we started with our standard therapy. God willing, he responded, a good response. And after 6 months, PET scan shows amazing response. Then this patient progressed after 9 months, but the wife was same. Wife was same. So I again gave a bad prognosis. Now it has reoccurred and all those things. Somehow I, as a doctor, remembered that I have given that 1.5 years ballpark figure with pancreatic cancer in this era does. So I was saying कि मैंने आपको बताया ही था पहले. I was told you all these things. मैं नहीं जाने दूंगी. So this patient then well-to-do family. They went to Sloan Memorial Sloan Catering Center, New York, and then they entered clinical trial. We have done all the investigations here in country. We have done all the next generation sequencing. Next generation sequencing is a test which tells you you might be a candidate for targeted therapy or some experimental therapy or out of box therapy. In those days, it was not sent. 3 years before, it was not sent. So they went to Memorial Sloan Catering Center and they picked up one mutation which was very rare, and there was a trial going on in Sloan for that. And this patient took that tablet for 4 years now. And the wife is going to Sloan every month to pick up those trial tablets. Hence proved that if you are investigated properly in cancer, if you have a will, if you are positive. So I met this patient yesterday.
Okay.
I have the record of this patient, and it's amazing to see that couple coming to our hospital, going to the cafeteria area, seeing me, then going for a coffee, giving boost to rest of the pancreatic patients that look, there are ways now. And she has made an NGO kind of thing where she's helping out my other patients to seek a way. And when there's an impending doom, if some caretaker of other patients gives you a roof, that is best. So there are many stories like this, but this story has lately touched me. The positiveness of a spouse, that she can go to anywhere, she will talk to anybody, and entering a clinical trial, going to US, finding out that doctor, finding out that drug, and she has done wonders for us. Now that doctor who was a part of a trial, who was treating this patient, and we are friends. So we are sending some more patients to the similar doctor.
Wow.
So connectivity, positiveness, and do not die before you die attitude. At times, we still can win cancer in stage 4. still
Absolutely.
can win cancer
So,
stage.
so then tell us about how important the caregivers are and
Caregivers,
we can
so
do it.
caregivers are the most important. As I said, we cannot even give treatment if the caretaker is not there.
Yeah.
But we have seen the health of caretaker. Tan, man, dhan, the basic ingredients of a caretaker. Tan, man, dhan. Caretaker का तन भी खराब हो जाता है. He gets frustrated. He gets burnt out.
Yeah.
He has to see the patient every time, crying patient or a happy patient. He has to come to oncology center with the patient every time. His cost of living, his office,
And he has no support.
he has no
She has
support.
no support.
So then he becomes obese. He starts eating. He starts thinking.
Yeah.
He's getting backlashes from his office.
Yeah.
And caretaker gets depression. He comes on those tablets. He has anxiety problem.
Yeah.
And he always sees cancer around him.
Yeah.
So, and it's a long course. He's doing it for last 3.5 years. And he is draining also.
Yeah.
Financially draining also. So caretakers are actually, at times I feel that I have to take care of caretakers rather
Yeah.
than patient. Patient can be taken care by the team.
Yeah.
I should concentrate on caretakers. So we have started doing a regular program, and our psychology department, psycho-oncology department concentrate on them. We have published a paper which our team is going to present in Berlin next month
Okay.
on the survey of caretakers, and we are doing a series, Direct Dil Se, taking care of caretakers.
Wonderful.
डायरेक्ट दिल से, बिकॉज इन लोगों का ध्यान कभी किसी ने देखा नहीं.
Exactly.
सब मरीज की बात करते हैं, स्टेज क्या है, कैंसर क्या है, आपको उल्टी तो नहीं आ रही, आपके वॉमिटिंग तो नहीं आ रही, बट कोई उनसे नहीं पूछता कि आप ठीक हो,
Exactly.
आपका वजन बढ़ रहा है, आप खाना नहीं खा रहे, आप चिंतित लग रहे हो. सो केयर टेकर आर इंजन ऑफ द पेशेंट.
Yes.
They are the tires of the patient. Without them, patient has no value. But if they are getting sick, if they are getting ill, it's our responsibility as an oncologist, because oncologists do not treat cancer patient. He has to take whole family into account. Many times, Samara, I did it.
It's wonderful to hear that.
I did it last week only. So patient came to me from just South City, and his disease was progressing, and I just asked the caretaker, "What's your age?" She said, "I'm 27 years of age."
Oh, God.
So I said, when are you getting married? So I'm getting married in February 2026. So I said, "Beta, go to Gurdwara and get it married."
Yeah.
Next week she came with chuda.
Really?
Yes. So we're talking about patient. Patient knows, and the father was so happy that Dr. Ankur, because of you, my milestone is achieved.
Yeah.
He was not getting married because of me, because I'm getting chemotherapy, there's short of money, but you gave a right solution that in 6 you can go to Gurdwara any Sunday and you can get, and she was so happy.
Yeah.
The boy who entered the family was so happy. Suddenly the number of caretakers were increased. Spouse came,
Yeah.
and the happiness increased.
Yes.
The patient is happy, the couple is happy. There's one more person who is a caretaker now. Suddenly, the interleukins, the chemical, हम भी तो chemical दे रहे हैं chemotherapy से, but उनके chemicals इतने खुश हो गए कि the family is happy. Milestones are achieved. Which father will not like his son or daughter to get married? I have a patient a patient is from Jammu, and she's doing economic honors in Christ College, and she was being diagnosed when she was 12 years of age, and we have a picture when chemotherapy was going on. She got 99.9% marks in 12th standard.
Yeah.
I could not do a what you call media coverage for this girl, because family says we are from Jammu, it's a very small city, सबको पता लग जाएगा, हमारी बच्चे की शादी नहीं होगी.
Oh my God.
So there are many touching stories.
Ground reality.
So ground reality. The girl is now in Christ, Bengaluru, but family thinks कि अगर जम्मू में पता लग जाएगा, अपने अखबारों में सब कुछ छाप दिया, तो हमारी बेटी को कोई अपनाएगा नहीं. But the Betia is so intelligent.
Yeah.
So there are many, many such theories which revolve around us. I wonder I can write a book for
Yeah, I'm
patients.
sure,
But
yes.
with emotion, some ghostwriter I get and I can write a book.
But you should, Dr. Ankur, because these kind of stories, just listening to you, it's the most powerful for, others who are going through this.
So we doctors, the person behind the stat, also have emotions.
Absolutely.
He also cries, not in front of you. He also weeps in not in front of you. And he also gets elated when the patient does very well. But we, as a training, we are not supposed to do this. As a training of an oncologist, we are not supposed to bring our emotions. We have to be professional. But yes, behind the scenes, behind our thing, we also think on a similar way what community does.
Yes, I'm sure. And that's actually one of the most important questions I wanted to ask you was you are seeing this every single day, happy stories, very sad endings every day. I mean, there must be highs and lows every single day. What do? You are human.
Yeah.
And we all need to understand that, and what do you do for yourself?
Yeah. So first of all, for myself, so it's all music. It's all music. I'm a music lover person. My kind of music, not be your kind of music, but I have developed my playlist. Can be a bathroom singer, and I eat a lot. My taste buds help me a lot, and most importantly, my colleagues. I have wonderful colleagues in the form of Dr. Nitesh Rodgi and Dr. Suman Karant. They are my buddies. They are my diffusers. I'm theirs. They are mine.
Yeah.
If I'm practicing in solo, so then this tension, this burnt out feeling will come early. But if I have good buddies around me, so they are like cushions to me. I'm cushion to them, they're cushion to me.
Yeah.
So group practice always helps you in this very difficult, sophisticated environment. But if you have good friends, good of oncology friends, it helps. Try to finish work usually by 7:30, 8 o'clock, going back to kids, playing with them. And most important, Samara, if you have not done anything wrong in the day,
Yeah.
if you have not done anything wrong in the day, कुछ गलत काम नहीं किया है किसी मरीज के साथ, किसी कलीग के साथ, किसी जूनियर के साथ, किसी सीनियर के साथ, I need a good sleep. That sleep will come automatically. But if there is a thief in my mind, a conflict in my mind, doing something wrong, which my colleagues do not let me. If my colleagues are should be such a colleague who doesn't let you do things wrong.
Yeah.
If my group practice doesn't let me go things wrong, then I will sleep. Then probably I will wake up early in the morning and go for a quick walk.
Yeah.
So we watch each other. We do not let our colleagues go down. And emotions, we get depressed. All those things happen to us. But yes, there are mechanisms. We are trained like this. Oncologist is trained like this. People see that we are in a very depressed environment, but we are in such a depressed environment for last 25 years. This is part of our training. We do some offsites things.
Yeah.
We go and take professional help.
Okay.
Professional help from, we do various exercises and the mental exercises and all. But I would say if you have a good peer, good colleague, ethical practice, know yourself, you will be a balanced oncologist. But if you're into an hanky-panky things, you have lots of conflicts of interest, you are not doing the right practice, good sleep will not happen that
Won't
night.
sleep well. Yeah. Thank you so much, Dr. Ankur. Thank you for the work that you do. Thank you for just being there, I think, as an armor for every single one of your patients and their families. And thank you for finally coming and sitting here
It's my
and having
pleasure.
this conversation
It
with
was
me.
just busy 2-3 months, but it's love doing this. Great.
Absolutely.
Thank you.
Thank you,
Thank
Dr.
you.
Ankur.
Yeah, pleasure.